Hi everybody. So today I'm excited to delve into the basics of reproduction biology. We'll explore the basics of female reproductive systems, discuss how reproduction works, and touch on some common diseases that can affect these systems. We'll also be looking at treatments, prognosis, and the role of hormone therapies in managing reproductive health issues. So I'm just going to keep it short and to the point. So reproductive biology is essentially about how humans create offsprings. It encompasses the structure and functions of the male and female reproductive systems, the process of fertilization, and the hormonal regulations that guide these processes. Now, understanding these basics helps us appreciate the complexities of human reproduction and the importance of maintaining reproductive health. So, let's go to the female reproductive system. So, the female reproductive system includes the ovaries. These are responsible for producing eggs, which are ova, and hormones like estrogen and progesterone. The fallopian tubes. These tubes transport the egg from the ovary to the uterus, and this is typically when fertilization. I don't know why that sounds funny when I'm saying it, but fertilization. There we go. This typically occurs, in the tubes. The uterus is a muscular organ with a, oh Lord. The uterus is a muscular organ where a fertilized egg implants and grows during pregnancy. The vagina is the canal that connects the uterus to the outside of the body, and it serves as the birth canal and the exit for menstrual flow. So, basically, maintaining the health of these organs is crucial for fertility and overall well-being, actually. Next, we're gonna go to the, the male reproductive system. So, the testes, these produce sperm and testosterone, and they are the primary sex organs for the male. The testes produce sperm and testosterone, the primary sex hormone. I apologize, I had that written down weird. The epididymis, is a coiled tube where sperm matures and are stored. The vas deferens, this duct transports mature sperm to the urethra in preparation for ejaculation. The penis, which is the organ that delivers sperm into the female reproductive tract. Each component plays a vital role in reproduction and hormonal balance. So in reproduction, gametes, these are the sex cells, which is sperm in males, eggs in females, and they each carry half of the genetic information needed to form a new individual. So, fertilization, which occurs when a sperm cell successfully merges with the egg cell, typically in the fallopian tube, resulting in a zygote. The zygote then travels to the uterus to implant and develop into an embryo. So, the ovum cell doesn't actually move on its own. Fimbriae are like tentacle-like structures that are on the entire inside of the fallopian tube, and they kind of play catch. They pass it to one set and then back to the other. It moves the egg slowly into the uterus. This process is fundamental to human reproduction. So hormones play a pivotal role in regulating the reproductive system. In females, estrogen and progesterone regulate the menstrual cycle, preparing the uterus for pregnancy, and influence secondary sexual characteristics. In males, testosterone regulates sperm production, libido, and secondary sexual characteristics like muscle mass and facial hair. Sexual responses involve a complex interaction between the nervous and endocrine system, leading to physical and emotional reactions that facilitate reproduction. So, maintaining reproductive health is essential. Some common concerns can include endometriosis, which is a condition where tissue similar to the uterine lining grows outside the uterus, causing pain, potentially leading to infertility, and treatment may involve pain management, hormone therapy, or surgery. So, uterine fibroids, these are non-cancerous growths in the uterus that can cause heavy menstrual bleeding and pain. Treatments range from watchful waiting to medications and surgical options. I actually had this problem for quite some time. It was not fun. Then we have polycystic ovary syndrome, which is also PCOS. This is a hormonal disorder that causes enlarged ovaries with small cysts, leading to irregular periods, infertility, and metabolic issues. Management includes lifestyle changes and the medication to regulate periods and manage symptoms. It actually can cause extreme weight gain in some people. So if you're having unexplained weight gain and you're a female, this could be the problem. Pelvic inflammatory disease. This is an infection of the female reproductive organs, often caused by sexually transmitted bacteria, and it can lead to infertility if untreated. Treatment typically involves antibiotics, right? And no, just antibiotics. Regular medical checkups and practicing safe sex are vital for preventing and managing the conditions that I just mentioned. Next, we're going to touch on fertilization and pregnancy. Okay, so once fertilization occurs, pregnancy, the fertilized egg implants in the uterus, and hormonal changes support the developing embryo. Pregnancy typically lasts about 40 weeks, not usually, and it's divided into 3 trimesters. So, labor, this process is by which the baby is delivered, involving uterine contractions and cervical dilation. As we learned, that's also a positive reinforcement by the endocrine system. So, lactation, this is post-birth, and the body produces milk to nourish the newborn, and this is regulated by hormones like prolactin and oxytocin. These stages are critical for continuation of life and require significant physiological adaptations. Now, hormone therapies are used to address various reproductive health issues. So, like hormone replacement therapy, often used during menopause to alleviate symptoms like hot flashes and prevent osteoporosis. It involves administering estrogen in combination of estrogen and progesterone. Testosterone replacement therapy used in men with low testosterone levels to improve symptoms like fatigue, decreased libido, and muscle loss. Each therapy requires careful